Welcome to the Dusty Muffins, where menopause meets sisterhood and strength. We're three menopause specialists coming together to laugh, share, and empower you through the wild ride of menopause and perimenopause. Whether you're curious, confused, or just looking for real talk, you're in the right place. We're here to answer your burning questions, educate, and advocate, all with a dash of humor and a lot of heart. So pull up your chair and join the conversation. Before we dive in, please remember, while we're doctors, we're not your doctors. This podcast is for educational purposes only and is not a substitute for medical advice. We encourage you to partner with your own medical clinician to address your unique health needs. This is the Dusty Muffins.
Okay, welcome back to the Dusty Muffins, where we keep it real about all things menopause, perimenopause, and midlife mayhem. And today we're getting personal. We're spilling the tea, or should I say the estradiol, on our own hormone therapy journeys. No filters, just real talk from three menopause specialists who aren't just dishing out advice. We're living it. I'm Dr. Rebbecca Hertel. I'm a board-certified osteopathic family medicine physician and a certified menopause practitioner in Pennsylvania.
I'm Aoife O'Sullivan. I'm a Menopause Society certified practitioner and a board-certified family physician here in Portland, Oregon.
Hi, everybody. I'm Christine Hart Kress. I'm a board-certified women's health nurse practitioner and a Menopause Society menopause practitioner, and I am coming to you live from Virginia.
Yes. All right, ladies.
Let's get it.
Here we go. This is the fun stuff. So this is real talk here. Christine, I know, has some fun stories with what
no
she's
hold
tried
barred.
before.
I don't know about that.
So, all right. So I definitely love my progesterone. I'll start with that because that was one of the first things besides like birth control pills. I was always fine with birth control pills. I did them, where I withdrew from them from doing like Yaz 3 months at a time. When I breastfed, I did the mini pill. Those were all fine. And then when I started through my perimenopause transition and losing my absolute mind and going bonkers, I was only told that I could start on progesterone. So I started with the micronized progesterone that at the 100, and I actually was fine with it. You want to know what it did? It made my boobs humongous.
Oh.
And I was like, what is going on with these things? Like when your milk comes in full.
Wow.
And I was like, and that probably took, honestly, a good 6 months before I either just got used to it or they didn't feel full. But I ended up going up to 200, and because for me, that's just where it helped me with my sleep. And it helped with the, anxiety, although not all the time. But I was titrating myself up left, right, stopping, going. Don't treat thyself, because it was a hot mess. But then ended up with 200. Now I will say I will drop down to 100 if I'm staying up late and I still have to get up early in the morning. Yeah. I will drop down to 100. And I take it all the time. I don't cycle it because I don't trust myself to remember to do that. And do you want to go around with each other's progesterones and start there and then circle around, or do you want? I don't want to be talking the whole time because maybe that's boring for everyone.
Yeah, I started both at the same time, estrogen and progesterone. Okay. And I started on I think just like the 25 microgram patch, really low dose, and 100 of the progesterone. And I just could not believe the sleep I was getting on that progesterone. I wasn't lying there awake half the night. Mm-hmm. And then with the estrogen, I wasn't having those middle of the night wake ups. And so that was the first thing I noticed. And then I kept going up on the dose to see if I could get rid of more and more symptoms. Because I do feel like women are so grateful to feel any way better. Like, oh, I am able to get off the couch now. I'm not an actual vegetable. That's great. That's enough, but no, you can feel better than that, so even with my patients, I'll go up on the dose and I'll say, try it out for a few months. And if you genuinely don't notice any improvement in any of your symptoms, we will drop back to the previous dose. Yep. But I feel like you can only know these things if you do a little trial, and with it being so safe, what's the harm, And then when I got up past the 50 microgram patch, or that 0.05 milligrams, I increased the progesterone then to 200. I also don't cycle it because I wouldn't sleep without it for the 2 weeks that I was off it. So I take it every night as well. Yeah. How about you, Christine?
Yeah, I started on the combi patch because I've never taken pills my whole childhood, adult life. I was the girl who would take a couple weeks of birth control pills at one time. So yeah, I never got pregnant. I think it was a miracle. But I knew that I
just don't do that at home.
Yeah, don't do that at home.
Don't try this at home.
Don't try that at home.
It was before I was a nurse.
Bad girl.
But you know, any of the worst
Liar.
timing. But anyway,
that's why
so I knew that
that was yesterday.
I wouldn't so I knew I wasn't reliable to do something every day. So I wanted the combi patch. I wanted to be one and done. And I had an ablation. So I, you know, haven't had any bleeding in, 15 years. So I wasn't worried about the bleeding piece of it. And so it was actually on the low dose, the 0.14, which we've talked about in other episodes in the last episode that, women will have a lot of bleeding on, but I had an ablation, so I didn't. What ultimately stopped me from that method was I was at work in the middle of clinic and my abdomen started just burning, and I thought I was going to lose my mind in the middle of somebody's pap smear when I was in clinic. And I went into the office and I had hives and welts all over me, and I couldn't wait to rip that bad boy off. So, I had an allergic reaction to the adhesive on the patch. And so, my first question was at the time was, is there latex in here? Because I'm latex sensitive, but there is no latex in there. But I just had an allergic reaction over time. And that's why, and I always rotated my patch. And so that's why I always tell people to rotate the side of their patch. So that's what, but as far as I did actually sleep great on it, and it took care of my hot flashes, and my anxiety and my hip pain. So those were my three things that were bothering me when I started it. So I was overall happy. And it took about a year before I developed that reaction and switched.
It was a year. Huh.
Hip pain. I feel like we could have a whole episode on hip pain. Oh my God. All of us have had that, right?
Mm-hmm. Yeah. I like the muscle. That was just wild. Well, the progesterone was all fine and dandy until all those hot flashes and night sweats, and I wasn't sure if I was like peeing myself in bed or what the hell was going on. And so I would just be drenched, and the migraines were worse, and I couldn't figure that out, and the brain fog and ADD, and I literally was like, I don't function like this. Like, I don't have brain fog. I can't get through charts and things like that. And so I finally found someone that gave me a patch, because I also take thyroid medicine, so an oral estradiol. And I really didn't want to take another pill because I was taking the progesterone and the thyroid medicine. I'm just like, I gotta take that in the morning on an empty stomach, and then the progesterone at night before I go to bed. So I'm like, just let me slap something on my ass and go. And that's what I did. So I think I started at the 0.03, and I was one of those like a-hole patients that I was like, ooh, this is good. After like 4 weeks, I'm like, let me do a patch and a half, and then let me go. And I was like, this is great. And then all of a sudden it wasn't good. I had horrific migraines, and my boobs hurt so bad. And I was like, all right, calm down, Cheetah. And I backed back up.
Under the supervision of a provider, right?
No, of course, because that's what we do. Yeah. So do not treat thyself, and do not get. It takes time. And I know I talk to my patients about this, and this is one reason why I do, because I was not patient, because I could tell I was feeling better and I just wanted to feel better. And, when you're in perimenopause, whether it's early or late, you probably aren't going to feel 100%. And back to yourself. That is one thing I have learned. I am still, my estrogen receptors, it's wherever they want to grab that estrogen. And I still get brain fog. My word fluency is still not there. I'm always afraid, even in these podcasts, I'm going to like forget something or be in the middle of a sentence or not get a word out. When I'm doing a live, it's the same fear. I'm just like, or teaching, I feel like I know what I want to say. And then it's still not perfect. And I don't know if that will ever come back or not, and so those are things that I think I try to tell my patients, because I've lived it and living it, that not everything is going to be perfect, especially until our ovaries shut down. And then we'll have an even better idea of maybe what's going to happen, for the rest of the time.
I agree, Rebecca. Like the word finding is awful. And brain fog, and I feel like I'm kind of at a good place hormonally now. And those brain symptoms still get me a lot.
It's so frustrating.
Yeah. In Ireland, if you get started on hormone therapy, in general, they put you on a sequential regimen. So you'll have your estrogen every day, but you'll just take your progesterone during the second 2 weeks of your cycle. Yeah. And they do that when you're perimenopausal and you're still having periods. And women, if you were to talk to them in those 3 months between when they start and when they go back to see their doctor, they have horrible side effects from the progesterone. But their doctor doesn't bring them back for 3 months. And by the time they see them back, they're like, yeah, everything's fine. All the side effects have gone. We just change things too quickly here, I feel like. We don't give it a chance to settle. Our patients message us and they're like, I'm having X, Y, and Z. And we want them to feel as good as possible. And so we make alterations, but I'm not always sure that is the right thing to do.
I agree with you. I really, really try to educate them, because I know it takes time and it's going to get better, and we really can't make those changes. Even with the progesterone, when they're, I don't want anyone to be miserable, but I'm just like, if you can stick with it, usually those things do go away, and, let's try to, but I get it. We're desperate to feel better. And now we actually have some kind of like hope that someone can make us feel better.
Yeah.
And we just are like, we want it all. And that, I think that, and maybe it's us doing a better job educating our perimenopausal patients, especially, that I can't shut down your ovaries with this kind of hormone treatment. And it's going to take some time, and we're going to have to adjust, and you've got to be patient with yourself.
Yeah.
Yeah. I, after I had like, I'm the girl that all the things happen to, right? So I had the combi patch, an allergic reaction to the adhesive. And then I had so then I wound up switching to progesterone and Divigel, and then I had an autoimmune progesterone dermatitis, and my face was like sloughing off, and it was red, and it was pretty horrible. I kept telling everybody I was allergic to Utah because I was fine until I went to see my son. And then I couldn't believe my face. And so I did switch to norethindrone, the birth control, the POPs, the mini pill. And I did that for about 6 months, but I have to tell you, it just didn't feel right. I am 50. At the time I was 52 years old, and I am taking mini pill birth control, and I couldn't even, I couldn't mentally get my head around the fact that I was on that for my progestogen. So after about 6 months, I convinced somebody to give me back my progesterone.
But you tried again.
Because my sleep was terrible. And so they gave me back my progesterone. I had a few, so I tried it first. The first time I tried it, I had the reaction again. The second, and then I waited waited about 3 more months and then tried it and did fine on the progesterone. But it's just an autoimmune reaction to high levels of progesterone. It's super rare. So thank you very much. Super rare. And then, I'm the oldest of the group and I'm still perimenopausal. I had an estradiol checked and my estrogen is 200 and something. It's like I turned 50.
Wait,
50.
When was that?
It was a
we
year
can probably
ago.
Tell you.
I'm having it redone next week. And I was like, because I don't bleed, so I don't know. And 200 is not from being on 0.75 of estradiol gel.
Not.
So, and I still ovulate almost every month. I have the symptoms. And so I'm like, well, isn't that nice? I was an infertility patient and now everything's working in my 50s. And so I've had to go up on my Divigel. I just couldn't stand it. I was waking up with more hot, more hot flashes and night sweats and stuff like that. So, I think, you can't give up because we wish we could put you in a box and do a blood test and figure out what exactly you should be on, but it is trial and error. And one thing I always tell patients is, how we decide what birth control pill you're going on? It's the pill that we use that the least amount of people call us with problems with. And so it's just a guess. Everybody has their favorite pill and we try it on everybody. And when it doesn't work, we course correct. But you have to be patient because it's going to take several iterations. And, I would say that with all my telemedicine patients, it's usually the 6-month mark where they're like, all righty, now, but where they're like, I feel good. And so you got to be patient.
Yep.
Yeah.
I did the patch worked for a great. I ended up like 0.05 at one point. And so, that was probably late perimenopause because I went like that 290 days, right? When I thought I was like, yes, 290 days and spotted. And I had an ablation too, but I still like spotted. And I was like, that's just a mean trick. That's just mean. And, I was so angry. We
were feeling bad for you.
Like,
we were very sympathetic.
Yeah. You were, yep. And then I cycled regularly for 6 months after that. I'm like, are you kidding me right now?
Crazy.
So I ended up going back to the gel because then I was having hot flashes at night and then, irritability during the day and tried the gel. I forgot that freaking gel. I was like in the car, putting it on my calf, rolling up my pants, traveling, with basketball or whatever. And I'm just like, okay, this is not working. Then I did the patch and then added some gel at night. And then I tried the Femring. I was like, okay, we're going to try this because I was starting to have some GSM and I really didn't.
GSM, you better define. You're speaking in acronyms.
So I know. I was having the Dusty Muffin. And so no one wants that.
Genitourinary syndrome of menopause. So vaginal dryness.
Yes. A Dusty Muffin, yes. So some vaginal dryness and pain with intimacy. And I was doing all of the things, right? So I was using vaginal estrogen, not as regularly as I should have been, I'm sure, because it's a pain. But anyways, I was doing it. And I finally was like, all right, let me try something that is every 3 months. I pretty much know that my dose is like 0.05 because the 0.075 gave me really sore boobs and headaches. And so I thought, well, maybe I'll just absorb that better. Plus it's going to also treat the vaginal complaints as well.
Yeah.
And that's been honestly a game changer. It's been pretty good. I will tell you that it did give me some breast soreness when I put each new one in a little bit. And then that really maybe for a week. And that did run out about 2 weeks before. I remember I was talking with Aoife and I was like, something's wrong. I think and she's going through and she's like, well, honey, do you think maybe you need to add some estrogen?
That's our answer for everything.
It is.
All the time, whenever we're on text stream, I think C needs some estrogen.
Can you stick an extra patch on? You're such a bitch today. Just put 2 more on. Put 2 more patches on.
I know. Slap one on when she's sleeping.
Right.
Rub the gel on.
I'm speaking about myself too. No one in particular. Like I am.
There are days when we do
Right
ask
there.
each other that. Do you need a little more?
Do you need a little bit more?
Yeah.
It's calm down,
Your
Cheetah.
patch, has it fallen off?
Which happens.
You know how you were saying your
It
periods
does.
got regular again, Rebecca. Like we see that sometimes, don't we? We see women who taking a little bit of hormones every day actually kicks everything back into action, which is why you have to be really careful with perimenopausal women that they do not get pregnant unless they really want a baby.
100%.
You have to be on birth control. So whether that is the Mirena IUD or the progesterone only pill.
Yep.
Or you don't want to do menopausal hormone therapy yet, so you're going to take the birth control pill. Or my favorite, which is the vasectomy. Condoms with a spermicide. Have I missed anything?
Tubal ligation, or I have the eShore device back when they were still doing that. So really, if you are perimenopausal and you're not trying for a baby, you have to have some type of birth control. Because that's what happened to me. I started going, and look at Christine, she's feeling like she ovulates every month. And so, and then I stopped again for 6 months, and then I just started again.
Oh my God.
So fun. Perimenopause is so fun.
That's why you needed a bigger ablation.
No, that ablation did not work very well.
Blowtorch in there. It's not, it's not much to talk about, but you're like, oh, okay. Sorry. I guess I was an asshole that week.
Life's too short to bleed unless you're making a baby.
I know.
Yeah. I find when my patients will follow up with me, probably through the portal, and they'll say, oh, I'm having XYZ side effect. And you get this urge to change the dose, like to increase it I'm feeling, what they'll say is, I feel so much better. X, Y, and Z is better. Can I try a higher dose? And I really have to rein myself in, because what you find with the estrogen, right, is that you stick that patch on or rub that gel on or put that ring in, and immediately there are some symptoms that magically disappear. Like for some women, their tinnitus will go away. Their palpitations could be gone within 24 hours for a lot of women.
Their tremors, even their urinary symptoms.
Yes, like things really within the first few weeks can feel so much better. But then don't you find that over the next 2-3 months, you notice still every few days you notice an improvement in something. And so really changing it before 2 or 3 months has gone by, really, I find causes more problems. Women will then say they're having some mood issues or they're having vaginal bleeding because you've stimulated the lining of the uterus, So...
And the other thing I'll see too, if I change anything, is sometimes those perimenopausal patients that'll get stuck in those loop cycles. And so their estrogen is so high and they're feeling terrible. And sometimes you will have to pull that patch off or half it or something because they feel even worse with that.
Can you explain the loop cycle again, Rebecca?
Yeah. So that loop cycle is when, your brain is sending signals to your ovaries because it needs estrogen, right? So kind of like we talked about the analogy with the thyroid, the brain sends thyroid hormone stimulating hormone and wants that thyroid to like send thyroid out. And so the same thing with the brain, and your FSH goes really high because it's like ovaries, I need some estrogen, I need it. And your ovaries are like, I ain't got none. Sorry, I ain't got none. And then all of a sudden it will send and release an egg, and this estrogen's like, and the later in perimenopause you'll have more of these. And I have seen these women with estrogen levels and like 300, 600, 700. And I have done extra workups on them because of that, to make sure there wasn't anything cancerous going on. But they really are miserable. They're moody. Their boobs hurt. They're agitated. Their depression is through the roof. And sometimes we think that that's low estrogen, and it's not. It's high. It's high. It's high.
Yeah. Which is why you really do need a specialist who knows all of this, because this is so tricky, isn't it?
Yes.
It's really tricky.
Yeah.
Right. And the
I
first
just
time
had my girlfriend tell me the same thing. She sent me we thought, menopausal, high FSH and estradiol. And she sent me both of her stuff. And she's like, use this for your content, and she's like, look at this from a year ago to now. And I'm like, I know. She was stuck in a loop cycle. And then she's like plummeted. Nothing's there.
Yeah.
Right. And, I remember the first time I saw an estradiol of 600, I about had a stroke, and I was not correlating it to the loop cycle. And I actually had my patients stop her estrogen, and that was because it freaked me out. I was worried. I'm like, what else is going on? I was working with someone that also wasn't familiar with the loop cycle. And so I think that's, it is important that you have someone that knows that, because the first time a provider who's not trained sees a 500 or 600 estrogen, they're going to tell you have to take your patch off, because they're going to be worried about stroke and blood clots.
Yeah.
And really,
and that's not doing it.
If you just wait another week, that estrogen will fall back down.
Yeah.
And as long as you're not having any issues, you don't need to do anything different. But if you're having side effects, then we usually back off on your estrogen for you. So,
and I would say that probably more of those, early perimenopausal patients where they sometimes will cycle their estrogen, that sometimes they'll go through times where they have to stop cycling because they're doing just fine, and then to add it back. So again, the importance of seeing someone that understands that, all right, well, now your ovaries are giving you enough estrogen. You're not dropping too low. Now you don't need that patch that week before your period, or that gel, that spray. Let's go off for a little while. You're going to know when you need it again, and you can talk to me about it. And so I will tell you with that ring that, it did not last 3 months for me. It was probably 2.5 weeks shy. So we'll see with the next one, but it's always nice because then we can tell our patients, hey, you may have to have a patch in the back or some gel in the back to support it before you get your next dose in. So that was just mine. I haven't tried the spray. So that's the only thing I haven't tried. I haven't, and not the estradiol, like the menopausal dosing. So other than that, any other fun? Christine's like reacted and had high. I haven't had any of that stuff. I know if my estrogen's too high, if I'm taking too much, usually the breast tenderness and then the migraines will start going.
Yeah, Jackie Piasta, I did her course, which is fabulous. And she says the 4 Bs when your estrogen is too high. So bloating, breast tenderness, vaginal bleeding, and bitchiness. Irritability. Yeah. So I usually forget one of those Bs when I'm telling these to a patient. So I'm kind of amazed that I am remember all 4. I'm like, I'll email you them afterwards. I know there's a 4th one.
Yeah,
I love.
No,
I
I
love
use
that.
I got that from. I got
that from Jackie.
It's so true.
It's so easy.
Because sometimes women think it's their low estrogen, and although it can't, obviously not the bleeding and stuff like that, but the agitation and moodiness and irritability. But I think sometimes we get stuck on that, and high makes you feel yucky too.
And that's why that's why we're good at what we do, because we'll be asking you other questions too, and so there'll be a lot of questions involved, and that will help give us, they're all clues as to what's going on, right? And we're
like
putting
little
these clues
detectives
together, to figure out whether you're gone high or you're gone low or what's happening. So it's really tricky. It is tricky.
Yeah. But it's really good.
And I don't know, but so here's a question. I'll share first. So I go to my primary care provider who prescribes my my menopausal hormone therapy. And I love her because she listens to me and does exactly what I tell her to do, but is admitted that she knows nothing. She didn't want to give me my hormone therapy. She was like, I'll send you to GYN. I'm like, I love my GYN nurse practitioner. She calls me and asks me for advice on how to treat patients. She doesn't know how to, and I'm friends with her. Like, I love her, but she doesn't know. And so we're, I'm just like so many of my patients, except, luckily the providers, like, all right, they know I know what I'm doing because I see their patients. But, it's so darn hard to find somebody. I would love to just be the patient and not be the clinician. And but that's not the way it is for me. I don't know what your experience is. Are you all having luck with of seeing somebody that knows what they're doing, or are you just co-managing?
We co-manage. Yep. At first, I think when I first started seeing her, she was the one that actually would put me on it, so it saved my life for sure. But now, since all the education and the experience, now I'm just like,
this is what I need.
Yeah. Or I text you, lovely ladies, and I'm like, okay.
And we say, stick an extra patch on.
Yeah, that's usually it.
I see a nurse midwife for my care, and she, like you, Rebbecca, saved my life. And I think I said this in a previous episode, but when I went in to see her, she said, you know what, you spend and have spent, so many years of your life taking care of other people. When you're here with me in this room, I want you to let me take care of you. Of course, I was a bubbling mess after that. Yeah. But no one had ever said anything like that to me. And when I look back at the medical care I have had when I needed it, like, the birth of my 2 babies, what did I had to go into the emergency room for something else. Like, I have had horrible care, apart from my actual OBGYN who came in and delivered the baby. Horrible birthing experiences, both of them, like really neglected by the staff and very, very odd. So for someone to actually say to me, I will take care of you, was like, I have never forgotten that moment. It was really important. And I try to remember to say that to other clinicians that I see as patients.
Yeah, that's really good.
That's really good. Mm-hmm. And it's important.
And I think the other thing is that I think, I think the danger, or I don't know, I'm going to call it the danger is that, I think that we don't always know what's best when we're talking about ourselves, like, right? So me trying to co-manage myself, I have blinders on myself, right? So I would love to find somebody who could just be like, let me do it. Let me do it.
We have to and that we let them do it, right?
Yeah.
Well, yeah, because providers make the worst patients, right? Because people assume everything. Or like, you're a family practice physician. What do you need in your birth? You know how to do it. Just do it. Mm-hmm. You've done it. So, but then you get ignored, then you get ignored. And so I think, being a clinician, it's difficult to be the patient. And I think for providers, it's difficult to care for a clinician as well. I think it's challenging.
Yeah.
And sometimes it's hard for us just to also be that patient and be vulnerable to someone who might be somewhat of a colleague, depending on who you're seeing too. Everything's fine. Nope, everything's good.
Yeah,
we're fine.
You don't want to bother them. Yeah.
Mm-hmm. Yep. You don't want to be that person that comes in with their list of like, although I like lists, it helps.
I love a good list.
I love them. Yeah. I'm like, I may not be able to get through all of them, but give me a list. Yeah. Let's take the most important ones and let's see what we can do.
I love when patients bring me, when they're organized and they're like, I'm like, I am all there.
Well, I didn't used to love that. Yeah, it used to be a real heart sink moment for me when someone would come in with a list. But at some point,
it can be intimidating at first.
At some point I started to realize this is helpful, because now both of us, we can look at the list, decide on the top 2 things we're doing today or 3, have the same agenda, so that when the patient leaves the room, they feel like they've had their issues addressed. Okay, we didn't get through the 10 of them, but we got through the most important 2. And I didn't have a different 2 than their 2. I chose the 2 that were most important to them, having scanned the rest of the list to make sure, because occasionally I'd be like, no, they cannot be your important 2 today. You're going to have to come back to me next week because these 2 are actually dangerous things. Like, I would be worried about these things. Yeah. So you don't always know what's best for yourself. And I have found now I've reframed that list thing. It is very helpful.
It is.
Well, I think it's because we're really maturing. We've matured with age and experience, because I agree with you. I used to hate the list, and I used to hate when people came to me with stacks of articles. Oh, that was the other one I did not like. But, when you really realize, when you really get mature enough to understand what your role is in the provider-patient relationship, then, I'm all about it. Bring it. Bring me stuff to learn.
Yeah, you're a team. We're a team. We make
part of it is ego
together.
Right? Part of it is ego.
Oh yeah. Put it away.
Part of it is the awful condition of medicine at the moment, where you might go in to see your doctor and they have 8 minutes to see you. I mean, what are they going to do with a pile of printed out articles that you've brought them in to read? They're just going to cry. I mean, they've got 8 minutes to see you and do a note that takes them 20 minutes. I mean, how do you do the math there? It's crazy. So there's so much involved in it.
That's why I'm loving telemedicine land in my own world, because I love my hour with my patient.
It's so nice.
And I love my EMR, and I love all my things that I have, and it doesn't take me that long to write my note. I mean, there's reasons why we leave, and now I enjoy patient care.
Yeah,
I mean, I always did, but I mean, I really enjoy it now. I'm not enjoying it and do it the way that you my eyeballs out with all the work I have when I leave.
Or feeling you're like choking in it.
Yeah.
Right,
it makes a difference when you have time.
Yes. All right. Who's closing us? Oh, I think you're closing us up.
Were you going to do it, Christine?
Do we have any key points?
Yeah.
I mean, I think our key takeaway is that
more estrogen.
You need to give yourself time, right? And that grace. Grace, and we be patient through the transitions and give yourself a good 3 months to adjust to whatever medications that you're giving, and that you will be on more than one iteration. We've all talked about the different things, and you know what? Try them, because you can, right? If your insurance will cover them, try them all.
I always tell them you're not married to anything. We can always change it.
Exactly. And, someone who's really comfortable in this space is absolutely fine with letting you try all the things. And then I think, we're perimenopausal women just like you, trying to figure it out. And we have the same struggles you have. And the reason why we chose these careers is because it should just not be that hard for anyone. And so we want it to not be hard for all of the people that we can help, and we can't help all of them. And one of the things that we're doing is a lot of training and education of other providers, because everybody deserves access to midlife care that is evidence-based, and that where you're the driver and we're the partner, and together we're figuring out the path, which will have many twists and turns.
Beautiful.
All right, our midlife tribe. Remember, you're not alone in this journey. Be informed, be empowered, and keep thriving through midlife. Until next time, stay fabulous.